Hi, I'm Bill Faulkner, and on behalf of the SMRT, I'd like to welcome you to the fourth video in our MR Safety Week Checkup video series. We hope you've been using these videos as a reminder of areas in which to evaluate MR safety practices at your facility. And so far, we've talked about evaluating your MR safety policies and procedures in general, and MR annual safety education for the MR staff, as well as safety in the MRI environment. In this video, we're going to look at screening procedures and patient preparation. First, remember, as was discussed in the previous video, screening should take place in Zone 2 for anyone and everyone prior to being admitted into Zone 3. This is also where ferromagnetic detection should take place if it is utilized at your facility. And if your site does use ferromagnetic detection, do you have very clear and concise policies and procedures for its utilization? And is it utilized correctly and consistently? The screening process and the screening forms for patients, non-MRI personnel, and MR personnel should be essentially identical. Specifically, one should assume that screened non-MRI personnel or healthcare practitioners or MR personnel may enter the bore of the MR imager during the MR imaging process. For example, you have a parent accompanying a child. They may reach up into the magnet there for some reason. Nursing personnel accompanying a patient may stick their head up in the magnet to check something or to inject something, like I said, check a line or monitoring equipment. You need to be sure that you have documented screening forms for everyone going into the MRI environment. This is one of the most basic and important parts of MR safety, and that is the safety screening. Here's a sample screening form courtesy of Dr. Frank Shellock. Now, these are freely downloadable from MRIsafety.com, and you can also find a sample screening form in the ACR guidelines. You should ensure that your screening forms are both current and comprehensive. Often I'll hear technologists or radiographers say that they are asked or even pressured to simplify the form in order to make it more convenient or easier. My response would be, what would you have me leave out or skip? Simplifying the screening form or the process will only increase the risk to the patient or the persons being admitted into Zone 3 and certainly into Zone 4. All patients should be completely screened prior to each and every MR exam by trained individuals. Non-emergent patients should be screened on site by a minimum of 2 separate individuals, and at least one of these individuals should be level 2. At least one screening should be done verbally and interactively. Remember, having undergone an MR procedure in the past is not an indication that a future procedure may be safely performed. With regard to implants and devices, it is extremely important to have good policies and procedures that tell us how to handle these patients. You need to identify the implant or device. You need to identify specifically the make, the model, the vendor, and so on. Get all the information that you possibly can, and then determine the MR labeling. If it's MR conditional, what are the conditions of use, and can you provide them? Again, be sure that your policies and procedures are thorough and clear with regard to identifying and researching implants and devices. Make sure any and all of your research with regard to these implants and devices is well documented. Remember that the final determination of whether or not to scan any given patient with any given implant, device, foreign body, and so on is to be made by the Level 2 MR personnel designated attending MR radiologist, the MR medical director, or a specifically designated Level 2 MR person following criteria for acceptability that has been predetermined by the MR medical director. Anyone entering Zone 4, patients, non-patients, support personnel, should remove all removable items. Patients should be dressed in MR appropriate attire, and this means no street clothes. Athletic clothing, and now just standard undergarments, can contain embedded metallic microfibers, and this is particularly true of athletic clothing. These have been documented to cause significant burns. In this case here of an 11-year-old girl who wound up getting very significant burns along her flank from metallic microfibers in her athletic clothing. This is just one example. Finally, look at your procedures and practices to minimize the risk of RF-related burns. All patients should be sufficiently padded, and this would be between 0.5 and 1 centimeter, to prevent contact with the inner wall of the MR bore. The padding can also be used, or should also be used, to prevent skin-to-skin contact. Common areas for burns due to skin-to-skin contact include the medial thighs and medial calves. Padding should also be used to prevent the formation of large caliper body loops. So, do you have policies and procedures to address proper patient dress and padding? And again, are they consistently followed? This is what I see most often. Sites have policies, but no one follows it consistently because it's not being enforced. The SMRT and the FDA collaborated on the production of an MR burn prevention poster. You can download this for free through the ISMRM-ISMRT safety webpage. And as you can see in this screenshot, it's available in multiple languages and sizes. This poster can provide your staff with a constant reminder of steps that can be taken to reduce the risk of what is most likely the most common type of patient injury in MRI, and that is RF-related burns. So that brings us to the end of the fourth video in our MR Safety Week checkup series. In our next and final checkup video, we'll review handling of emergencies in the MRI environment, in particular, medical emergencies and a quench. So until next time, this is Bill Faulkner. Thanks for watching and take care.